The story of antibiotics. We all are familiar with the word antibiotics, which means life-killing. It takes microbes' lives to save humans. Nowadays, every other doctor is prescribing them to treat various infections. But do you know how it evolved? In the pre-antibiotic era, people did not know the cause of infections, as no medicines were available. They used different techniques to cure diseases. The Egyptians used to apply moldy bread to treat infected wounds along with herbs. Bloodletting was a therapy used for over a decade. According to an ancient medical theory, the four fluids of the body, phlegm, black bile, yellow bile, and blood, must be in balance to preserve health. Their belief was diseases are due to excess blood, so they remove blood from the affected patient through an incision in a vein or artery or cupping. Leeching was also frequently practiced in Europe, Asia, and America to deplete the body of quantities of blood. They also used naturally occurring chemical compounds and elements that treated syphilis and wound infections and were excruciating when injected or applied on wounds. Every treatment has its hazard. It inhibited bacterial cell replication, but also harmed normal human cells. Before the emergence of antibiotics, people tended to die even from minor sicknesses. People's suffering was enormous. In the early 1900s, children with meningitis died, or those who survived had severe disabilities from deafness to mental retardation. Infectious diseases were the common cause of death globally. There was no treatment to cure even primary diseases. Diarrhea and pneumonia were the #1 cause of human extinction in the world. The discovery of antibiotics was a life-changing miracle for humans, as these diseases could easily be cured now without any hassle. As such, the period between the 1950s and 1970s was indeed the golden era of the discovery of novel antibiotics classes. It changed the world's perspective of treating infections. British scientist Alexander Fleming established the concept of antibiotics in the 1920s when he discovered a green mold called penicillin was killing the bacteria he was growing. He isolated the mold and found out it could kill several bacteria by inhibiting cell wall growth. No cell wall, no life of bacteria. Fleming searched for a way to control infections, as he was a captain in the Royal Medical Corps during World War I. He made it his goal to treat soldiers dying from infected wounds. Bacterial pneumonia killed 18% of fallen soldiers in World War I, but it killed less than 1% of soldiers in World War II. Penicillin changed the way we treat illness and wounds, and it all started accidentally just by green mold. Other researchers and scientists joined hands with Fleming and started recreating Fleming's experiment. In 1938, Howard Florey, an Oxford pathologist, worked with Ernest Boris Chain to produce more penicillin. Norman Heatley further contributed to expanding the work. In 1941, they found that penicillin could cure even severe diseases and infections, saving many lives. Fleming was also the one who cautioned us about the irregular use of antibiotics, which can cause resistance and results in fatal diseases, just like in the past. Antibiotics changed the theory of therapy in the entire world, but every blessing follows a curse. We should stop the irrational use to avoid going back to the pre-antibiotic era. If you learned something about antibiotics today, please leave us a comment in the comment section below and share this video with your friends and family.